The evidence-based treatment that we researched for this project is called family behavior therapy. Family behavior therapy is described as a robust intervention approach designed to treat clients struggling with substance abuse issues, along with a wide range of other co-occurring problems. Family behavior therapy was developed in the early 1980s when researchers sought out to address the lack of formalized behavioral treatments for substance abuse and the numerous complicating factors, such as comorbid diagnoses and poor therapy attendance. Family behavior therapy is an outpatient behavioral treatment for both adolescents and adults. Family behavior therapy has been demonstrated to be an effective treatment for substance abuse, along with a variety of other complicating factors, such as comorbid mental health diagnoses, family conflict, interpersonal conflict, exposure to high-risk situations, and other problems commonly seen in clients struggling with substance abuse issues. As you can tell by the name, family behavior therapy relies heavily on involvement of family members, whether it's parents, spouses, siblings, significant others, and even peers are encouraged to attend therapy sessions along with the client. Family members are also involved in the treatment planning, goals, and interventions throughout the course of treatment. In family behavior therapy, treatment typically lasts for 6 months and usually involves approximately 15 sessions. At the beginning of treatment, the initial sessions last for approximately 90 minutes and are eventually shortened down to 60 minutes towards the end of treatment. Family behavior therapy was inspired by behavioral and family system theory. Family behavior therapy was derived from the community reinforcement approach. The community reinforcement approach involves the concept of alcohol and other drugs being a strong inherent reinforcer and resulting in the person spending time in activities that are conducive to substance use. The community reinforcement approach involves working with the client to restructure their environment to make substance use more difficult, and then reinforcing activities that are healthy and do not involve substance use. Family behavior therapy involves working with the client and their participating family members to develop goals which are anchored to a contingency management system. In the context of family behavior therapy, this means a system of reinforcing rewards or withholding rewards depending on the client's behavior. So a simple example would involve an adolescent client with a goal to decrease or stop their substance use. The objective measure would be urinalysis testing, and the family, in this case the parents, would provide praise, privileges, and rewards for a successful period of time with no substance use, and they would withhold those rewards or perhaps implement consequences for failure to abstain. This is called a contingency management system and is one of the primary tenets of family behavior therapy. Family behavior therapy typically involves the heavy use of praise, compliments, and positive reinforcement. It utilizes behavioral contracting, which is part of contingency management, as I just described. It utilizes skills-based interventions, which aim to change the client's environment, decreasing the amount of time spent in high-risk situations or situations where substance use is likely to occur. Skills training involves helping the client to manage their urges and cravings to use substances and engage in problem behaviors. Communication skills training, which is designed to reduce the interpersonal and family conflict that is common with individuals struggling with substance abuse. The techniques involved in family behavior therapy involve the therapist working with the client and any participating family members to develop their own behavioral goals. Then, progress towards those goals and any positive behaviors are praised and rewarded throughout the course of treatment. Stimulus control, self-control, and communication skills training are some of the primary interventions commonly used in family behavior therapy. Stimulus control, one of the interventions that we will portray in our role-play video, involves identifying and managing the antecedents or triggers of the problem behavior. For example, helping the client to identify the triggers that cause them to feel like using substances, and then helping them to manage those triggers. Managing triggers involves helping the client to either avoid or minimize these triggers so they are less likely to provoke the problem behavior. The self-control intervention is used to reduce impulsive negative behaviors and promote healthy behaviors. Communication skills training is simply used to reduce interpersonal conflict and promote healthy relationships. Family behavior therapy recognizes that along with substance use and other co-occurring problems, clients often have significant interpersonal conflict, either in their family or their social circle, at school, and/or work. Communication skills training seeks to teach new communication skills to reduce conflict and help the client to effectively reach out for positive family and social support. One of the primary principles of family behavior therapy is that the family members and significant others are involved in all levels of treatment and treatment planning. It relies heavily on positive reinforcement, praise, and compliments, which are given by the therapist, the client, and the family members to each other in treatment sessions throughout the course of therapy. The client and participating family members are helped to determine their own goals of therapy, and the client and family members are then able to choose from the list of interventions that are all under the umbrella of family behavior therapy. So the client and family choose their own goals and then choose the intervention that they want to use with the help of the therapist. Another principle of family behavior therapy is the frequent use of between-session assignments or tasks. In our role-play video, we will portray the technique of stimulus control. We will have a client with a participating family member. You will see the use of positive reinforcement, praise, and compliments, and you will also see the client and family member choose which goal they want to work on, as well as the use of in-between session tasks. Family behavior therapy has been demonstrated to be an effective treatment for youth, adolescents, and adults struggling with substance abuse issues. Family behavior therapy has also been demonstrated effective at treating a host of other issues that are commonly experienced with substance use, such as co-occurring disorders like depression and anxiety, family conflict and discord, interpersonal relationship problems, school and work attendance and performance issues, as well as conduct problems, as often seen in youth. The setting for family behavior therapy is primarily an outpatient office setting, but literature suggests that under certain circumstances it can also be used in a home setting. The target population for family behavior therapy has several risk factors. These include all of the risks associated with substance use, a high incidence of co-occurring problems and comorbid mental health diagnoses, poor attendance and/or compliance with therapy and therapeutic goals, poor attendance in school and/or work, and exposure to high-risk situations and exposure to things like bloodborne pathogens, such as HIV. This population has an increased risk and incidence of suicide, as well as a high incidence of family and interpersonal conflict. In terms of adolescent population, negative peer and social influences, as well as a lack of supervision in general, are additional risk factors. Protective factors for the target population include at least one family member or significant other who is willing to participate in therapy. The means to access therapy or healthcare in general is another protective factor, and the strong evidence base that supports the treatment's effectiveness. We found a variety of sources that documented the effectiveness and usefulness of family behavior therapy. Some of the highlights include the fact that family behavior therapy consistently demonstrates efficacy in clinical trials. The positive results of therapy have been maintained up to 9 months post-treatment. The therapy is demonstrated effective in treating dually diagnosed adolescents and has been shown to promote several positive family-related outcomes. Overall, family behavior therapy appears to be a highly effective, evidence-based approach for treating substance use and co-occurring behavioral problems. Thanks for listening.